go over this question and say, well, this makes more sense because we have 1, 2, 3, 4, 5, 6, 7. You gave me $1, I gave you back $7, which means now you go through each answer choice. You learn that buy at 30, sell at 50. Then you said, oh, not only do I know that clindamycin, I learned that clindamycin is used for anaerobic infections like aspiration pneumo lung abscesses. Also, I go through azithromycin, and I'm learning that azithromycin is 50S inhibitor, which now we know, but also it's used for community-acquired pneumonia. Wow. And then you keep moving and shaking, because guess what? Metro is also pretty good for anaerobic infections below the diaphragm. Boom. Metro clearly has a different MOA. So this is not the right answer because Metro is a whole different MOA. However, although it's particularly effective against anaerobic bacteria, it is not the first line treatment of aspiration pneumo. So I hope you realize the test writer put this as answer B to fool a lot of people. Because if you went, they only got 3 people. Doxy stopped at 8%. The point is, Pharm, look at that, 45% of people got it right. If you only knew the buy at 30, sell at 50, which is one of the first things I've always done, I've repeated 1 million times in over 2 years, automatically that gives you the power to eliminate all but 2. Now you're down to 2. The analytical clinical knowledge has to come in and say, all right, well, some drugs are given for anaerobic infections, some are given for aerobic infections. Clearly, they told you aspiration pneumo. You need to know aspiration pneumo, anaerobic infections, foul-smelling odor, malodorous odor. There's questions. If anything affects the swallowing of a patient or chronic alcohol use or immobility, that can cause aspirating, which typically is an anaerobic infection. We typically give clindamycin as the answer. So you do it like this, ladies and gentlemen, one by one. You might do 85 questions, but it's 5 answer choices per question. It's 450 minimum answers you're going to review. So when a person does, let's say 40 questions and they go, yeah, I kept going, I learned the answers, kept moving. I mean, I might spend 2-3 hours on those 40 questions because I'm going to get a lot of return for my time. You know, I might eventually, if you follow parallel students, somebody who does 40 questions and just doesn't spend time reviewing a lot, and then you take me and my team, like you guys are on my team, I might do 80 questions, but I'm already at over 500 concepts. Now maximize that, amplify that by 7 days of doing 100 questions a day. 100 questions a day, that's 700 explanations. Times 5, you see how exponentially you increase your exposure compared to the average student that just says, I'm going to keep doing more questions. Now, this is for learning purposes, right? You need to be able to know your Pharm. You see something like this, ladies and gentlemen, you should, all of you, I'm pointing to all of you now, and then all of you watching this later, hi again. You should know rifampin, isoniazid, pyrazinamide, ethambutol, also streptomycin is the 5th one. Epididoxin is not even a ripe regimen. You all should know the MOAs and adverse effects because this is how you get easy points. Yes? Yes. So I want you guys to attack this list. I did this on review number 1. Obviously, there's a lot of questions here. Hit them all, man, and let me know. Do these questions, and I want feedback. Go to the online community and say, hey, I want to go over question number 83, 82, 79, whatever. If you have AMBOSS, you just go to these 3 dots here, click the little dots, push the button share, hit the copy button, then you go here, you go onto the online community. This is the beautiful online community. You can go to the section here and say, boom, here's a stupid link and say, Dr.